Welcome back to Daniel Ultrasound Clinic. Lady patient complaining of pain, severe pain in both loins, and almost she is crying. So on ultrasound, we started from liver. Liver, as usual, appears enlarged and showing increased echo pattern with homogeneous echo texture, no focal mass. Portal vein is normal. Here is the portal vein. So this is a fatty liver, category 2. And here is the right kidney. This is right kidney which appears normal in size, shape, contour is smooth, corticomedullary distinction is intact, and there is no stone, no hydronephrosis, no evidence of any pelvic ileal dilatation or stone. So this is gallbladder, cystic, showing no stone, no growth, smooth walls. So here we are going to the left side. This is this is left kidney. This is left kidney. It appears normal in size, shape, contour, no stone, no hydronephrosis. This is above it. This is splenic tissue, spleen. It appears also normal. Now let's go to the pelvis. This is ultrasound of whole abdomen, including pelvis. So on ultrasound, here is the uterus. Actually, we have how we assess the uterus. There is an imaginary line which is drawn from the one end to the other end. This is an imaginary line. Here is the imaginary line. We have to assess the uterine position according to that. The whole fundus of the uterus has been uh, dragged down, and the uterine cavity has been kinked, K-I-N-K-E-D, due to the acute retroflexion. This is retroverted as well as retroflexed uterus on its own axis. We say acute because it is too much retroflexed. Here is the retroflexion. The fundus is going almost to the back, on the back side of the uterus. So this is the acute retroverted retroflexed uterus. Here is this is the cervix. This is the cervix, and this is the vaginal area. The uterine fundus is going down here. You see, here is the uterus. Here is a kink. So this patient has got history of the C-sections. So probably it is due to any adhesions or fixed retroversion and causing severe pain. This is the point. When I apply passive pressure, the patient feels pain and tenderness in this area, in the pelvic area. So our main focus is on the uterus, which is retroverted, acutely retroflexed, causing severe pain. And now patient has to undergo many other investigations like cervical pap smear for cytology and pelvic examination and blah blah blah. So there are ovaries which appear normal, right and left. Here is the right ovary. This is the right ovary which appears normal. Similarly, the left ovary is also normal. Our main focus, again I say, is on the position of the uterus. So this is acutely retroflexed uterus on its own axis. Thank you very much.